Hey everyone, it's Dr. Luke.
And Dr. David.
We're back with another edition of Curiosity Corner.
Luke, I'm curious, how's your hamstring strain going?
Well, it's getting better. It's bruised.
Yeah.
And there's things I can't do yet. So.
It sounded pretty classical. Give kind of the audience what you were doing, what you felt, and then kind of what your initial response was, and then I can talk about what you should do going forward.
Yeah, I mean, this video is to help people that are going through this exact situation. That
Luke is living it
now. So very classical kind of etiology for a hamstring strain. I'm not a young guy anymore, but I like to play soccer, and was in the middle of a game sprinting, and I felt that grab right behind the leg here. No pop on that one, but it was initial strain, and that was about 5-6 weeks ago. Yeah, the initial one, and then I didn't go back to soccer, but I was in the gym. I was still working out and gradually getting back to things. And about 3 weeks after that initial injury, I was doing the deadlift workout, and it was lightweight on the deadlift, and moving it pretty effectively and efficiently, and no pain. And with that going down with the weight on one rep, I felt a pop. And an audible, and I heard a pop.
Right, feel a pop.
And my hamstring, and that sent me like straight to the ground. And obviously I knew that wasn't good.
It was significant. I mean, it was
significant injury, right?
Yeah. It's signs of kind of a moderate, significant hamstring strain. I can see now he's got bruising on that backside there. Hard to walk. Like when I saw you walk back into the clinic, he was limping. So it's pretty debilitating. I mean, how was the pain? And then we can talk about what.
Yeah, I mean, the pain was a good 6 or 7 out of 10. Similarly, walking, I could not bend forward. Just that attempt to even hit, I couldn't even probably do this initially, just because of that, the anatomy of the hamstring allowing you to lengthen to bend over. It was absolutely saying no, and the strain is ripping. That was actual tearing of the fiber.
Correct.
So.
Right.
So I think it would help if, you could act like you're talking me through what the stages of progression.
Well, you have to act like it, because in the clinic right now, I think I got 3 hamstring strains.
Yeah.
I mean, it's a very, very common thing. If any of you play fantasy football or have, an NFL receiver, hamstring strains, think about what Luke just described. He had kind of an initial injury that decreased his ability to probably tolerate length. It wasn't the next day, but within that 4 to 6 weeks from the initial injury, he had a re-aggravation, and that second aggravation was a lot more severe. In therapy, we're trying, you come in to see us for a hamstring strain, our ultimate goal is to prevent that re-aggravation. And so using our knowledge and knowing what happens in that tissue injury, it really, really shortens. And so our first line of defense is, can we slightly move it slowly to just decrease some apprehension to motion? We want to be able to move the knee, we want to be able to move the back, because that indirectly kind of affects that hamstring. So after we restore kind of that initial phase of, can we just move the extremity around the muscle issue? So that's the hip and the low back, and that's the knee. We start there. That's always kind of phase 1. Can we make you feel better? And then we want to say, can you just contract that muscle without movement? Can you tell that tissue to get back to what it needs to do? We call it the isometric phase. So that's just kind of digging that hamstring down. And we do it in a couple different varieties, but that's probably the number one thing we can do to take you from, it really hurts, I can't do anything, to it's starting to feel better. So if we miss that kind of initial phase and we just try to stretch it, right, and try to stretch our way out of the hamstring strain, we're more likely to aggravate, because that tissue's in a shortened state for a reason, because it's rehabbing and recovering and repairing itself. And so our number one thing, if anything you take away from this initial video, is don't try to stretch your way out of a strain, because you're probably going to aggravate. Right, and so we promote motion around the area, allow the body to do what it needs to do to recover, and then steadily we go towards mid-range flexibility to end-range flexibility to ultimate ability to use that tissue again. And it's going to take several weeks. So we go from can you contract to can you contract under tension to can you contract under length. And once you're there, then we talk about explosion and plyometric and ability to get that tissue back to what it has to do to prevent that strain from happening again. So non-painful motion first, make you feel good. Isometric ability, light loading, light to moderate stretching, and then end range flexibility, what we call eccentric loading, That's our protocol for the hamstring strain. So if you know anyone that has experienced what Luke has experienced, right? Don't just say, just stretch it, rest it, and you'll feel okay. Because if you just stretch it and you just rest it, you don't get back to what you need to do, right? So loading is super important. That's a missing link that we have to go from the acute injury to really a chronic injury. If you have a hamstring strain and it's 3 to 6 months and you still feel it, contact us. Reach out, because a lot of times you can try to stretch it, you can try to make it feel better, but you really got to load it. And if you don't know what to do, that's where we come in.
The other thing I would say about that, and David's spot on, it's been 2 weeks since the injury. Haven't stretched my hamstring once. Just working on movement, motion, starting to load a little bit. But
you're not limping anymore. You're
gotta go through the progression, like you said. The other thing to be very wary of is once you have a hamstring injury mid-belly, your risk for having another one is high. Okay, so you have to start doing the work to prepare it for stuff down the road, right? You got to be proactive with this for at least probably a couple of years to build resilience in that tissue again, because the likelihood of that happening again is high, especially if you're an athlete in sports. So something to be aware of. This is what we specialize in. This is what we help with. And if you're having questions or you're having issues, reach out to us. We're happy to help. And check out other videos. Subscribe if you like what you're seeing. And
stay curious.